Hello, everyone, and welcome to another episode. On today's episode, we're going to explore a topic that pretty much impacts our health and well-being, and we're diving into a topic that affects millions of people worldwide, and that is weight gain. Now, we have spoken about weight loss, so it only makes sense that we actually talk about weight gain. So we will talk about the factors that could possibly contribute to weight gain. We'll also explore common misconceptions and also discuss practical strategies for maybe managing weight effectively. So let's go. Before we even talk about weight gain, I'm gonna just talk about something that happened to me. This was literally a couple of weeks ago. So I went to a family event. They were having, music, food, whatever. And you know how it is with African parties, Steph. You go in, you say hi to everyone, and the older people are normally on one side, and then the younger people are together, and all of that, right?
Yeah.
So I tend to go to go to the aunties to say hello to them, just be like, yeah, how you been, and all of that, respect, right?
Yeah.
I should have just minded my own business, gone in, taken my plate of food, sat down quietly. But no, I had to go say hello to auntie, didn't I? So I go to speak to a family friend, an auntie, and we're just talking, and then she goes to me, God will punish her. She goes to me, oh, I see you're eating good nowadays. Look at your cheeks. You're eating much better, aren't you? Honestly, and my sister was right next to me. My sister, I could see her face. She was like, oh my God, she didn't just say that.
Oh no.
And my response was more of, yeah, oh, God is good. What do you say to someone saying to you that I can see you're eating better nowadays, your cheeks are looking nice, and no.
See what I mean? These aunties have no filters. I've always said it. Like, they need to keep their opinions to themselves. Nobody wants 100%. To know.
No, I mean, I'm sorry, gosh. But my cheeks, what do my cheeks have to do? Do you know what? And it's the fact that she went sly about it. If you feel like you've noticed I've gained, just hit me with it. Don't start coming for my cheeks.
Yeah.
Anyway, so my sister later on, to be honest, we're driving back home and we were laughing about it because we're like, of all the things she could have said to me, she could have said, "Oh, you look well. Oh, look at you. You look well." That's what normal people say, like, "Oh, you look well." Right? It's like, that is a compliment on its own. Like, okay, you look healthy.
Yeah, you're looking good these days. You're glowing.
You're glowing. That is a good compliment. But to come for my cheeks and to be sly about it, basically, she was trying to say to me, I look like I've gained a little bit of weight because apparently now I'm eating much better. So I don't know what I used to eat before, but clearly I look like I wasn't eating well.
No.
So I think it's worth to talk about weight gain.
Yes.
Just because, first of all, these aunties always come for us, and we all know as a generation that this is something that is a problem.
Yes.
Because we always say you don't know what someone's going through, you don't know what is going on. So sometimes it's just worth to sip it and keep it moving. She could have just said, do you want some juice? And that would have been enough. Or, are you sure you don't want some salad? And I would have got the message,
No, Julie, that's rude. Are you sure you don't want some salad? Come on, man. That's rude.
No, it's to say that, it's nice weather outside. Do you want some salad?
No, it's still rude. No, it's still rude.
Do you know what? Personally, though, I wouldn't have taken so much offense as to her saying coming for my cheeks. If she came to me and said, oh, do you want some salad? I've got some salad in the, and say I put my little bits. And the funny thing is my plate was empty because they had a lot of non-veg food, right? So they had it was a Kenyan event, so they had nyama choma, they had some chicken, they had vegetable fried rice which had prawns, so I couldn't even eat it, and then they had some jollof as well, which is all I could eat because it was just plain jollof, and then they had mandazi, which is like it's like an African donut or Kenyan donut, and then they had some samosa which was had veggie inside, but I didn't know what was in that samosa, so I didn't actually take it. So all that was on my plate was a little bit of rice and one mandati. So she could have even said, "Oh, do you want some salad?" See, because I'm vegan, I personally would take offense
Yeah.
to that, because it's like, do you know what I
Okay.
mean?
I
That's where
understand
I'm
that.
coming from.
Yeah.
Yes. So then it would be like, she'd be like, "It's good for you," She could have gone about it different ways, but to come from her cheeks
I
is like,
agree. I agree.
Auntie, I see
That's
what on your
no.
plate. At this point, I was looking at her plate. I'm like, look who's talking. She had layers
The
and layers and layers.
hypocrisy
Like, there
of
was
it.
melted
Oh
chorma, there was
gosh.
pilau, there was, yeah. So let's talk about weight gain. So,
Yes.
what is the clinical definition of weight gain, really?
Mm.
Like, how can we
So
describe weight gain? What is weight gain?
yes. So weight gain, as Trudy has put it, is when we put in a little bit of extra like pounds or kilos like onto our weight. So it could be, it doesn't mean that like you are obese, it just means that you have put in a little bit extra on. So there are different categories. You could gain weight and still be healthy, or you could gain weight and just be overweight, or you could gain weight and be obese. Yeah. So when it comes to weight gain, yes, it's just when you have excess weight than usual, basically. Yeah.
Yeah.
And
Yeah.
it could and it could be like due to like maybe excess body fat, and it could be related to different things. Like there could be different things why like you're not losing that weight. It could mean that maybe shedding that few pounds is being difficult, or it's a bit slow, so that's why you're not able to lose the weight. You have put on a bit. But weight gain in general, it is very common for many people. It can be caused by so many different things. It's not just about eating. There are different underlying things that can cause weight gain. I think we will delve into it. There are some diseases and there are some medications that can cause like weight gain, as well as like lifestyle, which is like maybe your eating habit or lack of exercises. There are serious things that can cause weight gain. So when people like our aunties making remarks or like comments about your weight,
Rude
sometimes
comments.
they do yes, they do need to understand that just because someone has gained weight doesn't mean that maybe they're living an unhealthy lifestyle. It could be because they're going through something serious,
It could be intentional as well. Let's be honest. It could be intentional. Maybe someone wants to gain a little bit of weight because they want to, I don't know, fit a certain way in clothes, or maybe they've been underweight and they just want to. So it could actually also be intentional. It's not always a bad thing. It's not like, as you said, it's not like they're living an unhealthy lifestyle, or their appetite has gone, through the roof or whatever.
Sometimes, people, as Trudy mentioned, people put on weight intentionally. Like, I do know some people where throughout their whole life, where they've struggled to maintain their weight, to actually gain weight. So sometimes people go through a process or a journey just to put on a few, but then some people as well put on weight because, as we mentioned, some diseases. So I think it's worth mentioning some of like the diseases, and like let's start off with like the diseases that can actually like cause some weight gain, and maybe shed light as to how to manage them later on as well. So I think I will start off with one that I think is quite common when it comes to weight gain. I'll start off with hypothyroidism. So this is when this is when your thyroid is underactive. So most of the time it's not making enough of the hormones, which is involved in metabolism. So therefore, your metabolism is being slowed down. So you're not able to break down like the calories or break down the fatty food easily. So that's when you put on a lot of weight. So hypothyroidism is like one of the major causes of weight gain. It does obviously come with other symptoms, but you will notice when someone has hypothyroidism, they actually have gained weight. So,
Yeah.
you know, people should be a bit kind, you know, when they notice that someone has put on weight. This could be
Yeah.
one of the reasons why, you know, there could be, they need medications for it, you know, just
Yeah.
to keep their hormones balanced.
Yeah.
Another disease I would mention, which we have mentioned in the past, is so common, is depression. Depression is
Yes.
a major cause of weight gain. I mean, let's take it for instance. Everybody, yeah, when you're going through low moods, you tend to, you know, indulge
Eat
a little bit.
more.
I'm gonna
That's
put my
it.
hands up. When I'm low, I get like my tub of like Ben and Jerry's ice cream, you know, put on a movie, you know, eat
That's
a bit
it.
of chocolate.
No one ever goes
that
for
sort of
carrot.
thing.
Like, I'm so depressed, I'm gonna eat a carrot.
So,
No. No, you want something that is, you know,
exactly.
yes, gives you a little bit
Yes.
of, yes, we're good. Yeah, no, 100%. 100%.
Yeah, so depression is a major factor because when you're depressed, you're gonna live like you're not bothered to do anything. You go for the easy food, like maybe some takeaways, some chocolate, something like that. You live that lifestyle. So depression is one of the major factors. And also,
Yes.
there's actually a scientific thing as well. When people are depressed, they also release this hormone, cortisol, the stress hormone. So there is a high amount of them, which actually causes a weight gain. So please, do not put someone down.
Stress releases the same hormone, so
yes, exactly. Don't put someone down when they've put on a bit of weight. You don't know what is going on mentally. They're probably going through a lot. So please be kind. Be kind.
yes.
Just because someone has put on a bit of weight, don't go, oh, you put on weight. It's going to make their depression worse. So please think before you speak. Yes. Yes.
Like some of these words make you think about, you know, about your life even worse. Like, oh my God, I'm going through this. And now I'm being told I've gained weight. So it's like, oh my God, my life is just falling apart. So,
you know,
listen, we always
that's
say.
That's one thing I don't want to hear.
Yeah, 100%. We always say, if you have nothing positive to say, just shut it.
Don't say
it. Easy.
That's it.
Like, you don't have to come with all the negative. Sometimes people know this thing.
Yeah.
It's like when someone's broke and you're telling them, you're so broke, you have no money. They know this.
Yes.
You don't have to keep reminding them they don't have money. Maybe the way of coping with things is just to try not think too much about it, but do something in the process of it. So yes, that's
exactly. Trudy, did you also know that insomnia can also be a cause of weight gain?
Yes.
Oh, yes, because people that actually have that get less sleep as well. I also know you may notice that you know they have put on a bit of weight, but that's because you know lack of sleep here can cause like your body to make too much of that hormone that I just mentioned, the cortisol, and it can also make your body make a lot of like insulin as well, so which all adds up to you like you know putting on a few pounds, and these hormones can mess up with like our hunger, like our crave for food, all of
appetite,
that, and increase like
100%.
and increase our load for sugar and fat. So again, insomnia, and and also one thing for the older women. Let's not put it down. Menopause is also a factor when it comes to putting on weight. So you aunties, we are very kind. We don't say anything to you when you put on weight because we understand, you know.
We understand, that's it. When you're having your hot flashes and I can see, okay, you've gained a little bit of weight, I'm very gracious, like, auntie, let's get a plan. You know, we understand you're going through something.
Exactly.
Put on 1 small kilo.
Mm.
They will come for
Yes.
you. No,
Yes.
definitely, definitely.
Yes.
To say
Yes.
it goes both
Menopause.
ways. It goes both
Yeah,
ways.
yeah, because
Mm.
during menopause they have like less estrogen as well, so they put on more
Yes.
fat. Yeah, and with
Mm-hmm.
menopause as well, you do get the symptoms of depression as well. You get sleep problems, like you become very moody.
Mm-hmm.
All of that is linked to the way
Yes.
you eat and all. So
Yeah. Also, a
you
decrease
know
in metabolic rate. The older you get,
exactly.
your metabolism is not going to be the same as it was when you're in your 20s. We all know
Yes,
this. The older you
yes,
get, the lower that rate goes. So
yes.
you will find that the food that you eat doesn't get metabolized as quickly as you would maybe when you were 20. I find that as well a bit now, Steph. I don't know if you do. I mean, I'm not menopausal, okay? But I find that maybe the things I could eat when I was like 20, I can't just eat now and be like, I'm good. Like
Yeah,
I could eat something and I bounce back. It's like, yeah, so
yeah.
yeah. But now you've got to be mindful. So with
It's
age,
so true with age. Yep.
yes. Mm-hmm.
It's so, so true. We can't eat like the way we were eating when we were kids anymore. Like my kids will be
No,
stuffing their face and I look at them, I'm
you're
like,
thinking,
okay,
wow, enjoy
you
your
continue,
youth.
you know?
Enjoy your youth. You don't know what's coming.
Yeah, honestly,
Yes.
honestly, yeah.
Nah,
Um,
definitely.
sorry. Another thing I think which is very common and we have spoken about, I'm sure we have mentioned it in the past, is
Mm-hmm.
polycystic ovarian syndrome,
Yes.
PCOS.
PCOS.
That
Mm.
is a major factor when it comes to weight
Yes.
gain. Like,
Mm-hmm.
I do notice a lot of Black people, yeah, when they have PCOS, they tend to eat a lot more. They tend to
Yes.
gain a bit of weight. It's because of the
Mm.
hormone
Hormone.
imbalance.
PCOS tends to mess up your hormone levels.
Yeah,
So your hormones are haywire; they're all over the place. So of
yeah,
course that's going to cause some weight gain. Or if anything, you might also find that your appetite is increased. So you might be eating a
yes.
little bit more than you normally would have. So yes, certainly
Mm-hmm.
PCOS.
Yes, yes. And I think another condition is Cushing's disease. I don't know if people are aware of that. It's usually when your
Yes.
body makes the cortisol a bit more.
Mm-hmm.
So, as we mentioned, the cortisol is a hormone that, manages stress
Mm-hmm.
and it's a stress hormone and therefore can also impact in like your appetite and can also increase in weight. So anybody that is
Yes.
on that has that disease will definitely be at risk of weight gain.
Yeah.
My Yes, the other thing I would say, a very common one, is diabetes.
Yes. Insulin
Diabetes,
resistance.
yes.
Mm-hmm.
Diabetes, you may notice that can lead to a lot of like weight gain, especially the type 2
Mm-hmm.
diabetes.
Mm-hmm.
You normally see that patients are gaining weight when they have type 2
Mm-hmm.
diabetes. Yes.
Yeah.
So I have mentioned a lot of like the conditions. There are many
Conditions.
more.
Oh gosh,
Yes, there are
yes.
many more, but these
Yes.
are like the main ones I wanted to like
Mm.
mention. And
Yes.
as we mentioned previously as well, there are some medications that can cause you to gain weight. So, Trudy, do you
Yes.
mind taking over and letting us know which ones
Yes.
can cause
Nah,
that?
of course. Yeah. That's great. So certain medications, as we always say, have or can potentially have certain side effects, and some of the side effects that some medication would have is something like weight gain, and there is quite a few medication that has got
Mm-hmm.
weight gain as a side effect. Now,
Yes.
depression is a condition that honestly can cause quite a lot of impact on your health. So we have said that when you're depressed, you might find that you're eating a bit more, which can cause, of course, weight gain. But also
Yeah.
certain antidepressants,
Listen.
especially the SSRIs like sertraline, can actually cause weight
Mm-hmm.
gain as a side effect. Now, I think it's also what we'll do is we did have an episode on seasonal affective disorder, and we had Dr. Gavoni who talked about these things. So we'll link that as well, just for you to maybe go have a look at it if you're suffering from maybe depression, just to have an idea of some more of this information. But yeah, certainly certain antidepressants can actually cause weight gain as a side effect. Also, some antipsychotics have been known to have weight gain as a side effect, especially second generational antipsychotics. So we're talking the likes of quetiapine, olanzapine, the likes of those, and they're quite common. A lot of patients are on this kind of antipsychotics. They can actually be associated with weight gain because that is a known side effect that comes from this medication. So if you're taking some of this medication and maybe you've noticed maybe there's a bit of weight gain, please speak to your healthcare professionals as to how to manage that. There is normally going to be, if it's quite drastic and it's getting in the way of life, there is ways to manage that. So either maybe change the medication or maybe just go about it differently. Maybe try to treat some of this the side effect. So that is normally an option that is available. Now, another group of medication that can actually cause weight gain is anti-epileptic medication. So if you suffer from epilepsy, you might be on a medication like sort of valproate, or you might even be put on gabapentin for reasons of epilepsy, just to help with like managing some of the symptoms of epilepsy. And unfortunately, some of this medication might actually cause weight gain as a side effect in some individuals. But again, bearing in mind that we always say side effects are things that could potentially happen, not necessarily things that will happen. So we're not saying that now you go to your doctors, you're like, no, I don't want this medication. I've been told it can cause weight gain. Take the medication. You might not even suffer from that as a side effect. So it's just worth having these very open and honest conversations with the healthcare professionals, and also giving medication a chance, because just because it affected someone a certain way doesn't necessarily mean that it should, and it will affect you the same way. And I hear a lot of probably you hear the same from some patients where they don't want to be on certain medications because of the side effects. Like, oh, my grandpa was on this, or oh, he was on olanzapine, he gained so much weight, or my mom had it, I don't want it. Look,
we get that
until
all the
you
time.
take the medication, you don't know how it will affect you. We always say medication is very tailored to an individual, so it will work a certain way for you, might not work the same way for someone else, or it could cause certain side effects on someone but not another person. So
that's right.
Side effects are always things that can potentially happen, but please don't take it that you've heard this or you've seen this or someone has had this as a side effect, so you don't want the medication. No, please take the medication. It might affect you differently. Another group of medication that is known to cause weight gain is steroids. So corticosteroids, especially long-term use of corticosteroids like prednisolone, can actually lead to weight gain. And this is normally due to sort of like fluid retention as well as an increased appetite. You might be aware that when you're on, say, some steroids, you're told to take them in the morning. It's all to do with this whole cortisol. We have talked about cortisol. We probably will need to talk about it in detail because cortisol leads to a lot of things, and but it could be the reason why you're having weight gain because of certain medication that you're taking. And in this case, a steroid, especially long-term use of a steroid, can actually cause weight gain. Now, a lot of times, so steroids can be used, especially corticosteroids can be used in patients who have asthma, for instance, right, for management of like a flare-up or an asthma attack or whatever. But what happens is some patients become so dependent on this that as soon as a little bit of, they go for steroids. And we're always very keen to just say, okay, don't take it long term, don't depend on this medication because of the side effects, the long-term side effects of this medication. And a lot of times, I don't know about you, Steph, but we're going back and forth with some patients because trying to get them to understand that long-term use of certain medication is not really preferred can be quite challenging. So weight gain is something that can be caused, especially you've been taking steroids for, different conditions for a very long time. You might notice that maybe you've gained a bit of weight. It could be because of, certain things like fluid retention, but steroids are certainly known to cause weight gain. Also, some antihistamines can actually cause weight gain as a side effect. So the likes of hydroxyzine can actually cause weight gain. So it's always important just to know some of the side effects that can be associated with the medication. I am not for patients reading the patient information leaflet. I always say, actually, please don't read it. But if you have any questions, come to me. The reason I say that, now I'm not saying don't read it, but I have an explanation for my driving, not reading the patient information leaflet, is because on that leaflet it will tell you the common side effects, the not so common side effects, and the least common side effects. But what happens is people read the least common side effects and they're like, nope, I've read that it can cause death. I am not ready to die. No, I am not having this medication. And honestly, trying to go back and forth and explaining it becomes so challenging. So that's why I always say, if you're that kind of person where you might take some things a bit too, serious, it might be worth maybe just talking to someone as opposed to reading something. And also Googling, a lot of people go on Google and they put their drug, and someone who read something on, I don't know, some fiction or non-fiction book, wrote something, and you go ahead and read that and you think that this is actually a side effect that can be caused by a certain drug, and chances are it's probably not the case. But yes, certain drugs can, like some certain antihistamines can cause weight gain. But again, it is something that can potentially happen, not something that will definitely happen.
That's right.
We have talked about insulin resistance or diabetes being a reason why someone might have weight gain, but also just to mention that certain diabetes medication can actually cause weight gain as a side effect. So some insulin can actually cause weight gain as a side effect, and a certain group of diabetes medication can also cause weight gain as a side effect. Especially, this is normally especially if your blood sugar levels are not well controlled. So if you're diabetic, just have that regular check. If you have a diabetes nurse or diabetes team, please have these conversations with them. If you notice some of these things, have these conversations with them, because then you will, you'll find a way to sort of like manage some of these side effects or even the symptoms, basically. And the only other group that I can think of is beta blockers. Certain beta blockers have been known to cause weight gain. It's because they work by possibly slowing down the metabolism. So propranolol is one of them, and it can actually cause weight gain. But again, it doesn't mean that it will cause weight gain. So some people have taken propranolol for years and they haven't noticed any side effect in regards to weight gain. So as we always say, it's just very, very important to discuss any concerns about medication, about side effects, including weight gain, with a healthcare professional, so that they can provide guidance on managing side effects and also explore any alternative treatment options that there is available or that is necessary for you. Now, those are just certain, maybe very common medication that can cause weight gain. There is a list of medication that can cause weight gain. Unless there's any other common ones, Steph, that you can think of that I haven't mentioned.
I think the only other one I was thinking was lithium.
Oh, yes. Yes.
That was the only one. Yeah.
Yes, lithium has been known to cause weight gain as a side effect. So if you're on lithium and you've noticed that maybe you've put on a few extra pounds, it could be because of the lithium. But again, we're not saying that when you're on this medication you can eat the way you want. You're like, the side effects with the drug, no. And if that has been happening before you started on the medication, chances are maybe it's not the medication, maybe it's certain certain lifestyle choices or lifestyle changes that are possibly causing weight gain. Now, in regards to, I think you've mentioned certain conditions that can cause weight gain, but also genetics. Genetics plays a
Yes.
significant role in determining if there's any susceptibility to weight gain, and of course,
Yeah.
people's response to diet and exercise.
That's right.
So yes, so just as a guide, genetics is normally sort of passed on, isn't it? So it's, you know, if say your parents have struggled with certain things, genetically you might do the same, or if they've had certain conditions, what could happen is you probably will also have the same. So I don't know if there's any better way that you can sort of like explain this, Steph, but how I always look at it is, you know, you're the product of your parents, and they're the products of their parents. So if they've had,
Yeah.
let's say, a low metabolism, then you could also have that genetically, and that
Yeah.
will affect how efficiently the body will burn calories for energy. And so you could end up maybe gaining weight because of that, or even
Yeah.
things like fat storage. If of course, you're storing a lot more fat in different areas. You know, some people store fat in say the abdomen or the hip area or the thighs.
Yeah.
You know, like they always say, like you can tell someone from, like you can tell where someone's come from by the shape of their body, right?
Yeah.
So like you can tell a Ghanaian, you look at a Ghanaian like, and then you look at Kenya and you're like, yes, I can see where that girl is from. You know, it's just in around, you know. So
Yes.
it's all genetics.
That's right.
It's what makes genetics. So individuals with certain genetic predispositions may be more prone to maybe storing excess fat, particularly in
Yeah.
certain areas. And people mostly in sort of the midsection area, which is
Yeah.
normally associated with sort of a higher risk of obesity related health problems, and also like
Yes.
hormonal regulation. So this is also passed on, you know. So genes involved in hormonal regulation, like insulin, leptin, can actually affect metabolism and fat storage. So things
Yeah.
like that can actually play a role in maybe weight gain or not being able to lose weight as much as you would like. Unless Steph, if there's anything else I've missed there.
No, I think you've mentioned practically all of them. Yeah, you have. I think that's
Yeah.
practically it. Yeah, these are like the major causes of it. Yeah. Um.
Right. So if say
So
someone was struggling with weight gain, how do they go about sort of managing it? I know we've talked about weight loss. We
yes,
have an episode on weight loss, right? Which again we should link on this episode.
yes.
But what is the, I
The
suppose, the general guide when it comes to weight
yes.
gain and weight loss?
Okay. Okay. So as we've mentioned, weight gain can be caused by different factors. So the main thing to do about it when it comes to managing your weight gain is looking at what is causing your weight gain. If it is an underlying disease, we need to first of all, manage that disease. If it is hypothyroidism, we need to get you on medication. If it is diabetes, we need to get you on medication. If it is a medication causing your a weight gain, that's when the doctors may maybe possibly either change or reduce the dose, or probably advise you on like certain lifestyle changes as well. So we always have to look at what is causing the weight gain.
Yeah.
If it is to do with lifestyle, obviously lifestyle changes are very, very, very important when it comes to losing weight. So you need to look at your diet. Are you eating a high calorie diet? Like if you're eating a lot of fatty foods, you need to cut down on that fatty foods. So you may want to opt for low calorie diets, like eating, foods that are a lot more healthier, eating loads of
Yeah.
fruits and vegetables, that sort of thing. So look into your diet. Diet plays a major role and it really does resolve, like in most cases help you lose weight. Again, maybe your physical activity, perhaps you're not exercising regularly or as much as you should be. So please do exercise if you're not exercising. I mean,
Mm.
lately a lot of people do exercise. I see a lot of people going to gym. It has become a norm. So
Yes.
yes, make sure you are exercising. I think when it comes to like losing weight as well, there's different things we can do. I'm not sure if I'm sure I've mentioned this to you, but intermittent fasting does really help as
Hmm.
well when it comes to like losing weight. So I'm not sure if people are aware of intermittent fasting. So this is how I do it. So let's say, for instance, I wake up and most people will probably, have some breakfast, and I delay my eating time. So I'll probably have my first meal usually just once a day, probably like
Hmm.
around 1 o'clock or something. And this is
Hmm.
mostly when they call intermittent fasting. It's when you delay you delay your eating basically. So
Hmm.
you fast like maybe in the morning and then eat at lunchtime, and most of the time you probably don't eat again until the next
Hmm.
day. It doesn't really starve. It doesn't mean you're starving yourself. It just means that,
Hmm.
like, you're not eating as regularly and as much as like you normally would. I
Yeah.
I think intermittent fasting works for me. So it depends on
Yes.
the person, but for me,
Individual. Yeah.
intermittent fasting
Yeah.
works for me. Calorie counting as well works for some people to lose weight. So
Hmm.
yeah, you could do calorie
Yeah.
counting. So that's when like you watch like the amount of like calories you're eating in a day,
Yeah.
that sort of thing.
Hmm.
Some medications, which we have mentioned in like our earlier topics, do help with weight loss. So you can opt for some medications when these things do not help. So eating
Hmm.
healthily and exercising. Um, Another thing that has become common these days that we do see is that people are opting for like surgeries. I don't know
Mm.
how you feel about it when it comes to like surgeries. There are different types of like surgeries out there as well when it comes to weight
Hmm.
loss. I mean, I don't want to go into it. I'm not a professional, but there are different kinds, Um, but when it comes to surgeries, I always say just check, make sure you do your research. There are a
Yes.
lot of people going to Turkey to have that gastric bypass
Gastric.
surgery.
Yes. The gastric sleeve.
Yeah,
Mm.
that is another option. If that is your option, by all means, go for it. I don't know
Yes.
how you feel about it, Trudy. How
I
do you feel
always,
about
do you know what?
surgeries?
I feel like with something like that,
Mm.
it's it's not really something that we can really very highly either discuss or even recommend, because we don't really
Yeah,
know much about it, right? And every individual is different. So let's be honest, some people have gone to some of these places for surgery, and
yes.
it's been fatal. So there's been complications, and then there's been a life lost. So just be very careful about some of these things. Speak to your doctors,
Yeah.
see first of all what options there is available for you before you seek some of these things. They always say, like,
Mm-hmm.
gastric sleeve, they put that sleeve and you can only eat very little, and it works like that. And I actually have a friend who has had a gastric sleeve surgery, and to be fair, her
Okay.
before and after, you can definitely see the difference, right? But that's because
I
she went
see.
through all the other options. So she tried diet and exercise, didn't work.
Mm.
Again, it could be genetics. She tried certain medication, it didn't work, and then this was the last resort. And she
Okay.
went somewhere, I won't mention where,
Yeah.
and she got her surgery done. And she has lost
Yes.
weight and she has maintained this.
Okay.
But it's also worth noting that this is not a permanent fix, that's it, now you can come back, eat
Yeah.
whatever you want. The body doesn't work that way. Just because you've had
No.
something like that doesn't mean you can now go ahead and no. Like, sometimes also, if you've gone through that process, it might be worth to come back and maybe just have a good routine where the things you're eating, the things
Yeah.
you shouldn't be eating, and things like that. But When it comes to recommending it, I'll be very honest, I cannot speak on it. I'm not saying don't do it, don't go for the gastric sleeve surgery. By all means, the people who do it are doctors. So they will have the best knowledge as to if this is suitable for you or not. But please do some due diligence. In everything we say, in everything we talk about, we always say, do your due diligence. So speak to someone who is a professional in that department. Find out if that is actually something that's suitable for you, because if it's not, it can actually be, the outcome of it could be quite severe. It could be fatal. We've heard and seen cases where people have gone for some of these surgeries and then they didn't make it. So when it comes to things like that, I always reserve my take on it, in terms of, I can't tell you if it's good for you or if it's not, but please speak to someone about it. But one thing, when it comes to even things like intermittent fasting, just make sure you're also speaking to your doctors and your healthcare professionals and the people who you normally get healthcare from. The reason I say that is, so something like someone like a diabetic patient might not necessarily this might not be suitable for them, because to do with
definitely.
all of that. So just make sure that you've gone through that thorough check. Don't just, because something like intermittent fasting has become very, very popular now, and it works for some people, not to say that it will work for everyone. So just make sure, please check your medical history, check your health history, check with your healthcare professionals with your medication with the medication that you're taking. Is it okay for this? Because certain medications have also got to be taken with or after food. So if you're taking your medication on an empty stomach, you could actually be doing your body more harm than good. So just please do some of this due diligence, do some of these checks before you just, go ahead and make certain decisions.
That's right. Yeah. I totally agree. Yeah.
And when it comes to weight gain, Steph, there is certain things that people can do if they wanted to gain, to gain weight. There is certain things that people can do that is healthy. Some people go for like the unhealthy ways where, they just want to, so they'll eat unhealthy foods. No. That is not the way to go. Because people say that like, oh, I'll eat it, I just need to gain some weight. But there is cardiovascular diseases when it comes to things like that. So if you're eating high cholesterol foods, high carb foods, which are being converted into fats, that could actually do you harm. But what is available normally, just as a general guide, what is available for weight gain?
For weight gain, so as you've mentioned already, when it comes to maybe gaining weight, first look into like your food. So eating like high calorie foods, that usually helps. Maybe you can still eat like your vegetables, but maybe incorporate some protein as well, some lean protein. So these usually like add a bit more calorie to your food. What I sometimes I might say to my patient, you could add like maybe a little bit of fat into your food, if you want to gain weight. Like let's say drizzle a bit of like mayonnaise into your salad, and because the mayonnaise has a bit of like fat in it, but obviously you're not gonna go overboard. It's all to do with balance when it comes to these sort of things. Putting on weight, the different things, like you do see some people using like the protein shakes and the supplements as well, just to put on a bit of like weight. But all in all, I would say it's about looking at your food, looking at your food and building on that. I do know that some people struggle with weight gain. Like it could be because of maybe some condition they have. So I may find out that some people actually start to take some multivitamins. Apparently it helps with their appetite and stuff. So if you're someone that struggles with like putting on weight, it may be worthwhile to like maybe take a bit of like some multivitamin to help you gain weight. But some people honestly do struggle with weight gain, like putting on weight, and we've spoken about putting on weight, and some people don't like it, but others are struggling to actually put on weight. So
Yeah.
yeah, but all in all, if you want to put on weight, just do it in a healthy way. Don't overdo it.
Yes.
Don't
Yeah.
eat like really bad foods, because again, like, eating a lot of fatty foods and stuff can clog up your arteries. So you don't want to be eating so many fatty foods and then end up like, hurting yourself. So do it in a
100%.
healthy way. Do it in a healthy
Yes.
way. Put on the weight in a healthy way.
Yeah.
So
And maybe speak to a
yeah,
nutritionist as well. If it's something, I would say
exactly.
something, things like that. Maybe speak to a nutritionist.
Yeah,
Speak to someone who this is where what they specialize in,
yeah,
because they'll be able to do something that is tailored to you. Because as we always say,
exactly.
what someone else is doing does not necessarily mean you can do
No,
any work. It will work on you the same way. So speak to a
yeah,
nutritionist and see what they say. They might recommend some, certain drugs that Steph said to maybe increase appetite. They might also maybe even suggest certain drinks that there is available, the likes of 40 sip and the likes, which is a drink that is okay, and it's been approved for just helping with sort of like high calorie intake, so things like that. But I always say
yeah,
speak to a nutritionist. If you're on a journey where you're like, okay,
exactly,
you've struggled for a while, pay that little extra, speak to a nutritionist, and at least you'll be doing something that is right by your body. Do you know what I mean?
exactly.
You're not just going and doing
Yeah.
whatever you're reading or whatever. So yes, definitely. So in regards to weight gain, what is your take home, Steph?
Yeah. So with weight gain, when it comes to weight gain, I would say it affects each person differently. So you could be gaining weight due to some underlying disease, due to some medications. Some people can gain weight because of their genetics. So it affects everyone differently. It could be caused by different things. One thing I will say, people just need to be mindful when someone has put on weight. Personally, I don't want to hear it
Yes.
if I have put on weight. Do not, people need to think before they speak. Don't be pointing it out that somebody has gained weight. If somebody has gained weight, I'm sure they can see it. They just need to speak to their healthcare professionals so that they would get the right advice and right treatment for it.
Yeah.
People can be going through a lot of things when that are causing them to have this weight gain. It could be mental, it could be mentally, so please be mindful when it comes to weight gain. When it also comes to like the way to manage weight, to manage your weight, make sure that you're looking into factors like the food you're eating, your lifestyle. Are you living that lifestyle, eating a lot of takeaways, a lot of fatty foods, drinking beer, alcohol? All of these add to you putting on weight. So please check your lifestyle if you have noticed that you've put on weight. If you have, do cut down on these sort of things. Also, if it is an underlying disease, as I mentioned, speak to your doctor so that they will manage that disease for you. But all in all, when it comes to weight, please be mindful about what you say. Whether someone has put on weight or lost weight, just be mindful. Watch the words you use, because it could lead to something else. It could be detrimental to their lives. So watch the words you use when someone has put on weight or lost weight. So
That's it.
please be kind and speak to your healthcare professional if you need any advice when it comes to weight. What would you like to add on with?
So when it comes to weight gain, mine is simple, okay? Because like in my case, this auntie who said this to me, I probably wouldn't see her again for the rest of the year, right? So she probably just said something, and she gets on with, she just gets on with life as normal. But you leave
Yeah.
someone else thinking about certain things, okay? Because I looked at my sister right after. I was like, hold on. I mean, have I
Oh.
really gained that much weight? I know, like, it's winter, in the winter we eat a little bit more, trying to get warm, trying to get that blubber to just,
Yeah.
keep us warm. But it really messes up someone's psychology, someone's,
Yeah.
feelings, emotions and things like that. So what I always say is this: when it comes to certain things that we say to people, if you're not looking out for them, okay, certain comments, side comments are not worth it. Like, keep it to yourselves,
Exactly.
okay? Because if it's, say, coming from my mom that maybe 5 years later, like, I've been gaining, and it's a point where she's like, okay, this could be a bit, this could be catastrophic. Let's intervene. That's different. That's someone who actually cares about you, that they want you to do something about your health, But some of these aunties, and we always say aunties because it's always an auntie. They just want to. It's like they're practicing their own, freedom of speech. Like, they just want to say it and then keep it moving. But you don't realize that what you've done is you've left someone thinking about something that they weren't even thinking about. To them, it was not really even an issue, but you've left them thinking about it, like, oh my God, shall I? Because I said to my sister, so are we running tomorrow morning? And I'm telling you, until now, it's haunting me. It's haunting me.
Oh,
So it's little things like that. So just
Yeah.
be very mindful about the things you say to people in regards to their weight gain. As we have discussed
Exactly.
earlier, there is different factors that can actually cause weight gain. There is different medication that can cause weight gain. So no, the person might not be eating well. That's why their cheeks are coming out like that. It could mean that maybe it's a medication I've started taking, or maybe a condition, that I've very recently been diagnosed with. So you just never know what is going on with people. So be gracious, okay? When people have gained weight, listen, sometimes it's just best not to say anything unless you have something positive to say. But whilst talking about weight gain, we have discussed about different things that can cause weight gain. It is influenced by a complex interplay of different factors like genetics, lifestyle habits, environmental influences, things like that, medical conditions. So maybe finding out what is possibly causing your weight gain could be crucial in just going about the right steps to maybe losing the weight or managing your weight. And it is not really, to be fair, as a society, we're not very big on weight, but it is, unless it's getting in the way of life, unless it is also unhealthy weight gain, it's not something that we should really be that deep on. Like, a little bit of weight gain, I need to do something. It could mean that, as we always say, in the winter we tend to eat a little bit more. It's cold, it's gloomy, you just want to get in and eat something, something warm. You don't want to have the salad. So in the summer, chances are you'll have that salad, and that way that weight will gradually sort of just come off. So it's something that can be managed. Weight gain can be managed in different ways, as we've mentioned, but also if you need to gain weight, there's different ways to go about it, but always please find a good balance. Don't do what is popular. Don't go as per the trends. Go about it the right way, because it's your body at the end of the day, and you only have one body, one life. So every little decision you make will impact the bigger picture, will impact a lot of things. So be careful about certain things that you practice, certain things that you get into, and also just things that you ingest and things that you do. Just be very, very careful about some of these things.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.